Hi everyone, thanks for joining us. Today we'll be talking about Cymbalta, also known as duloxetine, a medication that helps manage nerve pain for spinal cord injury. Spinal cord injury can change everything. People often deal with long-term nerve pain that's tough to treat. Cymbalta or duloxetine can help ease that pain. Now in this presentation, we'll look at how spinal cord injuries affects the body, how Cymbalta works, and what is the side effects we need to keep an eye on, especially within the mouth.
What is a spinal cord injury? A spinal cord injury happens when the spinal cord gets damaged. This can affect how someone moves, feels, or how their body functions overall. The injury can be complete, where there's no movement or feeling below the injury, or incomplete, where there's still some function. How serious it is depends on where the injury happened, and it can affect daily life in many ways. Causes of spinal cord injury. This is the etiology. Spinal cord injuries can happen for different reasons. Some reasons, for example, can be trauma, like a car accident, falls, or sports injuries, or even a gunshot wound. Others aren't caused by trauma at all. They can come from things like tumors, infections, certain disease, or even a stroke.
Cymbalta is used to treat nerve pain, also called neuropathic pain. This kind of pain is common after a spinal cord injury. Cymbalta helps by increasing certain brain chemicals that controls how we feel pain. This can help reduce the pain and also improve mood and daily life. How Cymbalta works in our body. Cymbalta is taken by mouth and it reaches its peak level in the blood about 6 hours later. It processed by the liver and mostly exits the body through the urine. Its main job is to keep more serotonin and norepinephrine in the nerve system, helping the body block more pain effectively. As you can see in the picture illustrating, there's neurotransmitters and receptors. Those neurotransmitters are released into the receptors, and the receptors send signals to our nerve system so that way it could help block the pain more effectively. Now, there is interactions and side effect with this medication. Cymbalta can interact with other meds. For example, taking it with ibuprofen can raise the risk of bleeding, and if it's taken with Prozac, it might build up too much in the body. Some common side effects include dry mouth, nausea, constipation, dizziness, and high blood pressure. For dental professionals, dry mouth is the big one, and it raises the risk of cavities and gum disease.
Dental concerns and xerostomia. One of the biggest side effects we see in the dental chair is dry mouth. This can lead to more plaque, tooth decay, and gum problems. We can help by recommending things like saliva substitutes, drinking more water, sugar-free gum with xylitol, and keeping up with regular cleanings. Helping patients stay healthy. We can really make a difference by spotting dry mouth early and helping patients manage it. Remind them to brush and floss well. Give personal advice and team up with their doctor if needed.
Spinal cord injury can bring a big change to someone's life, especially when it comes to dealing with ongoing pain. Cymbalta can be a helpful option for managing that nerve pain, but like any other medication, it can have some side effects, some that affect the mouth, just like dry mouth. As dental professionals, it is important for us to understand how this medication works and how it impacts their oral health. When we stay informed, we could better support patients not only with their teeth, but with their overall health. Thanks for watching.